Brooks says that in acute cases, the correct similium shall abort the progress of the disease and health is restored in double quick time. Now, what that means, let's show you practically.
We see a lot of people comparing homeopathy and allopathy. Usually it is believed that our remedies are not as effective as the allopathic drugs while handling acute cases. Now, if we refer the literature, it says the exact opposite. If we believe our literature, then it says our remedies can cure the acute cases much faster than any allopathic drug. Let's read from the literature.
Hahnemann says that all acute diseases should be aborted. Why should we not expect to do this, if Hahnemann did so 100 years ago? Why call ourselves homeopathicians, if we cannot do as well as Hahnemann did? Why not offer this as a test of our ability and skill, and consciously admit that we must abort all acute diseases, or cease to call ourselves homeopathicians? There can be no better test for our work and for our position than to announce to the world that we do this, if we do it, and let all others compare their work and stand or fall by the test of clinical experience. Let the near homeopath, the highly scientific laboratory doctor, the Christian Scientist, the eclectic, the osteopath, or whatever he may be, come in and show what he can do to abort acute diseases. We must stand by the test. All our homeopathicians know how to do this work and make good. Hahnemann says, in his Organon of Healing, paragraph 149, if we profess to follow Hahnemann, let us display to man what we do to entitle ourselves to the name and to disfranchise pretenders. Pretenders will at once come to the front and reveal themselves by denouncing us and affirming that it cannot be done. They thereby only declare that they cannot do it, and hereby convict themselves of being only fraudulent or pretended followers of Hahnemann. Even if they affirm that they are only modern homeopaths, they must disclaim on the work they do pretensions. Homeopathicians abort all acute diseases. What do others accomplish? It only remains for us to educate the people, so they will know what to expect, and what can be done, and who can do it. But first, the education must begin with the physician, so that he can meet the requirements. Some will say, we do not believe it, which simply means that they have not seen such results, and this only signifies that they do not know how to apply the remedies homeopathically. Then, let the education begin at home. That there are many professed Hahnemannians who are not doing this work in this way is no reason for our silence. It is enough to know that Hahnemann did it, that many others are doing it, that we should all do it. If we cannot do so, let us give up our pretensions.
Acute diseases are those which have a sudden onset, progress rapidly, have a tendency to finish their course more or less quickly, but always in a moderate time, and ends up either in recovery or death. This means that the acute cases that are not fatal or life-threatening shall recover by itself after running out its course. The intensity of the common symptoms in an acute illness tends to decline as the disease runs out its course. Now, there are two ways to handle an acute disease. One is to control the intensity of the observed symptoms so that the patient feels a little better throughout the period till the acute disease runs out its course. This can be achieved by any allopathic prescription or even with the so-called homeopathic patent prescription, cough syrups, tonics, and tinctures. To understand this better, let's listen from a patient.
തുമ്മലും ജലദോഷവും ഇട്ട് തുടങ്ങിയിട്ട് ഞാൻ സാധാ മരുന്ന് മേടിക്കുന്ന പോലെ അലർജിയുടെ ഗുളികകളാണ് എനിക്ക് തന്നത്. അത് കഴിച്ച് ഞാൻ വർമ്മേലി ഒരു ഡോക്ടറെ കണ്ട്. ആ ഡോക്ടറെ കണ്ടപ്പോൾ ആ ഡോക്ടർ എനിക്ക് മൂക്കിലടിക്കാൻ ഒരു സ്പ്രേ തന്നു. ഒരു മാസം മൂക്കിലല്ല വായിൽ വെച്ച് അടിക്കണമെന്നും പറഞ്ഞ് 1 മാസം അടിക്കണമെന്നും പറഞ്ഞ് 2 നേരം അടിക്കാൻ പറഞ്ഞു. ആ സ്പ്രേ അടിച്ച് കഴിഞ്ഞ് പിന്നെ ഡോക്ടറെ ചെന്നപ്പോൾ ഡോക്ടർ പറഞ്ഞു 1 നേരം അടിച്ചാൽ മതി എന്ന് പറഞ്ഞു. അങ്ങനെ 1 നേരം അത് അടിച്ച് കുറച്ച് നാളായപ്പോ ഡോക്ടർ പറഞ്ഞു 3 മാസം കഴിഞ്ഞപ്പോ ഡോക്ടർ പറഞ്ഞു നിർത്തിയേക്കെന്ന് പറഞ്ഞു. അത് ഞാൻ നിർത്തി കഴിഞ്ഞപ്പോ പിന്നെയും എനിക്ക് ശ്വാസം മുട്ട് പിന്നെയും തുടങ്ങി. അത് ഞാൻ ഹോമിയോ മരുന്ന് മേടിച്ച് കഴിച്ചത്. ഹോമിയോ മരുന്ന് കഴിക്കുമ്പോ ആ ഡോക്ടർ ചെല്ലുമ്പോ എനിക്ക് ഒരു തുള്ളി മരുന്ന് തരും. 5 തുള്ളി 3 രാത്രിയും രാവിലെ രാത്രിയും കഴിക്കണം. ആ തുള്ളി മരുന്ന് കഴിക്കുമ്പോ ഉണ്ടാകാറില്ല. അത് തീർന്നു കഴിയുമ്പോ പിന്നെ ശ്വാസം മുട്ടുള്ളൂ. അപ്പൊ ഞാൻ പിന്നെയും ചെന്ന് മേടിക്കാം. 1 മാസത്തിൽ ഒരു 2 പ്രാവശ്യം മരുന്നിന് ശ്വാസം മുട്ടാണെന്ന് പറഞ്ഞ് പോകണം. അത് അങ്ങനെ കഴിച്ചോണ്ടിരുന്നേക്ക്. അതൊരു 5-6 മാസം കഴിച്ചേ. ചെല്ലുമ്പോ ഡോക്ടർ മരുന്ന് തരും, അത് കഴിച്ച് മാറും. ചെറിയ ഗുളികയും തരും.
The second, much more effective, and recommended method is not to allow the acute disease to run out its course and abort its progress, so that health is restored in double quick time. This can be achieved only by a proper homeopathic prescription. Let's see an example.
Let's see a simple example of a case of viral infection. As you can see in the video, the child has running nose, nasal irritation, and mild fever. Depending upon the totality, a homeopathic remedy was prescribed at 10 p.m., followed by another dose at 11 p.m. The child went on to sound sleep after the second dose, to wake up only in the morning, without any symptoms, curing the patient. Now let's see as to what Wikipedia says regarding the treatment for viral infection. Viruses commonly have self-limited life, so treatment is usually to reduce the symptoms only, and antipyretic and analgesic drugs are commonly being used. The patient shall recover within a week. In the case that we had just shown, the child was restored to health in just 1 day. Now let's see one more example. What you see in the image shown is a case of STI. Let's again read from the Wikipedia. STIs normally heal on their own by rupturing within a few days to a week, causing the relief of symptoms. But if it does not improve or it worsens within 2 weeks, a doctor's opinion should be sought. Let's now show you the picture, taken the very next day. This is what the rightly selected homeopathic remedy can do. It shall abort the progress of an acute disease, leading to recovery of the patient in double quick time.
We hope that was convincing enough to make you understand as to what it means by aborting the progress of an acute disease. Now let's see what we can do in chronic cases. We are not going to mount any of the theories upon you, but shall show you the practical evidences to make you believe.
In chronic cases too, we are much superior. We aim at removing the disease as a whole and not just the symptoms. In all those cases where no irreversible damage has occurred, we can revert those changes and restore the state of health. To understand this better, let's listen from a patient.
എങ്ങനെയുണ്ട് മരുന്ന് കഴിച്ചിട്ട്? വേറെ ബുദ്ധിമുട്ട് എന്തെങ്കിലും ഉണ്ടോ? ഇല്ല. മരുന്ന് ഇപ്പൊ നമ്മൾ കഴിക്കാൻ തുടങ്ങിയിട്ട് ഇപ്പൊ 2-3 ആഴ്ചയായില്ലേ? എന്തെങ്കിലും വ്യത്യാസം തോന്നിയിട്ടുണ്ടോ? നല്ല വ്യത്യാസം, ഒരുപാട് വ്യത്യാസം ഉണ്ട് അല്ലേ? ഇപ്പൊ രാത്രി എണീക്കലൊക്കെ ഉണ്ടോ? അങ്ങനെയൊന്നുമില്ല.
അങ്ങനെ ചുമയൊന്നുമില്ല. ആ കഴിച്ച 2 ആഴ്ച എനിക്ക് ഇടക്കിടക്ക് ഇങ്ങനെ ഒരു ബുദ്ധിമുട്ട് പോലെയൊക്കെ തോന്നിയായിരുന്നു.
ഇപ്പൊ കുഴപ്പമൊന്നുമില്ല. ഇപ്പൊ 2 മണിക്ക് എണീക്കുന്നൊന്നുമില്ല.
ആ കിടന്ന് കഴിഞ്ഞാൽ നേരമ്പളത്തെ എണീക്കുള്ളൂ, ഒരു കുഴപ്പമില്ല.
Now, in such cases, if the patient is educated regarding giving a temporary relief and permanent cure and asked to choose one, what do you think the patient will choose? Friends, to sum up, the scope of homeopathy is too vast. It's just that we have not made a sincere attempt to master it.
In our upcoming monthly editions, we shall not only show you practically how these cases were worked out, But also you shall get a chance to witness tons of such cases.
Although a physician can survive following the first method too, but as it's said in the literature, let them cease to call themselves as homeopaths or a follower of Hanuman if they fail to abort such acute cases. Every physician needs to ask their own conscience as to, are they able to abort each and every acute case that they get? If not, then, who is at fault? Is it the literature, or the methodology that one follows? If it's the methodology that is at fault, then, don't we hold a moral responsibility to correct ourselves, keeping in mind the best result for our patients? It's now your turn to think.
Case studies are a crucial ingredient of a presentation or a seminar. Many of us attend such seminars to witness these, but unfortunately, they finally end up listing remedies based on some keynotes or baseless clinical experiences for various clinical conditions. We too shall have a case study in each and every one of our editions, but our way of presenting the case shall be entirely different and very innovative.